Hello, we'll get started here in just a minute. Anybody out there tell me if, give me a 1 in the chat if you can hear me. Just put a 1 in the chat if you can hear me and see everything okay. We'll get started in about 30 seconds here. All right, we're going to get started. Looks like everybody can hear me all right. Thank you very much. I appreciate that. And let's get rolling. All right, my name is Lauren Marbs. Welcome to the online Medicare seminar. I'm going to be your host today. I'm very glad that you had the opportunity to join me for this presentation. I think you're going to absolutely love the information and the content that I'm going to be giving you. So most of you are here probably because you have a lot of questions about Medicare. Either you're going to retire or you're just turning 65, and we're going to walk you through start to finish on this, how this whole thing works, what your options are, and what you need to do before your 65th birthday and starting Medicare if you're retiring. With that being said, there's a lot of things that are specific to a person's situation and location. So because of this, I'm not going to be discussing any prices. I can't. There's just too many variables to discuss pricing in this type of setting. We have people from all over the country on this webinar, and there's just no way to do it. So if you're here looking to compare pricing, I can still help you, but we'll need to set up a one-on-one phone call for a personal Medicare assignment. And if you want to do that, just click on the green button that's on your screen now, and we'll get you taken care of. I'll give this just a quick second for anybody that wants to schedule that appointment now, and then we'll get moving on. Okay. All right. That didn't go up there. Sorry about that. Had a little technical problem. Can everybody see that green button? You should all see it now. If you're just looking for pricing, please grab that and set an appointment, and we'll get you taken care of. You're going to have multiple times throughout this to set an appointment if you decide, hey, I'm just overwhelmed, or I'm running out of time, or things like that. Just let me know, and I'll flip this back up on the screen. Okay. So if you're looking to know about Medicare, just stick with me. You'll see the green button, like I said, come up, and let's turn you into a Medicare expert. All right, I know you're probably thinking, me, a Medicare expert? Lauren, what are you talking about? I don't know how it works. I don't know what the options are, and I don't know how to avoid the penalties and fees that I keep hearing about. Well, you're right, but that's as of right now. The truth is, you're here today because you have a desire to learn the facts that you need to know. Once you have that correct information, you can then make an informed decision. More than half the battle is a desire to learn. Today, I'll be your coach, and with your desire and my coaching, you'll become a Medicare expert in no time at all. Now, most seniors I talk to are confused and frustrated. They're trying to find the correct information about starting Medicare and what plan will best cover their health insurance needs. If you're turning 65 or you just went online to look at pricing, you're getting bombarded with Medicare information. Your phone is ringing nonstop from telemarketers that you can barely understand. And your mailbox is stuffed with junk mail. It all looks official, but it's just advertising. Now, you can spend hours surfing the internet, looking at websites and videos to get some direction on which product is best. But at the end of the search, you're still going to have unanswered questions. The problem And the problem with listening to friends and family or trying to search on your own is you're just getting pieces of the puzzle. You won't understand how those pieces go together. Medicare is not one size fits all. The right choice for Bob at work most likely is not going to be the right choice for you. I talk to seniors every single day who have tried this method, and now they're more confused than they were before they started. Now, I can't stop the phone calls or the junk mail, but today I will give you the information you need to discern fact from fiction, and you'll be able to make an informed choice. Everyone's searching for this information, and how great is it going to be that you can rest easy knowing how the Medicare and the plan you choose are going to protect you for years to come. Now, you're probably thinking, Lauren, why are you so passionate about Medicare? It seems like a boring subject to be passionate about. Well, I'm going to tell you why. The reason I do what I do is that the leading cause of bankruptcy for retirees are unexpected medical bills. I think it's very sad that our seniors, people that have worked their whole life to grow a nest egg for when they retire, are just one step away from losing it all because of an uninformed decision. The leading thing that is taking financial freedom away from people just like you is a bad decision about the medical coverage that they will have in retirement. And they get those unexpected medical bills and they're not able to pay for them. That's something I care deeply about. I want to make sure that seniors are being taken care of and have the coverage they need to protect their nest egg. Because let's face it, we don't make more money as we get older. The good news for you, however, is you are going to be a Medicare expert by the end of this presentation. You're not going to make those mistakes because I'm going to coach you through this and teach you the entire process. I will teach you how this thing works and give you the facts you need to make a well-informed decision about what coverage you'll need to secure your future. Now, I tell you this because I'm really on a mission to help as many people entering Medicare as I possibly can. My mission is to send a simple message. Medicare is not that confusing. Medicare can be very simple, and making a good Medicare decision is not hard, but only if you have the right information from a trusted source. Remember, the decisions that we're making in life are only as good as the information that we're receiving. And I'm here to give you the correct information today. Now, you all probably want to know, Lauren, who exactly are you and why should we listen to you? Well, you might have seen me online from one of my websites or my YouTube videos. I have a ton of them out there. But if this is your first time and you're asking, who are you, where do you come from, and why should I listen to you? I'm going to tell you a little bit about myself so you know who you're dealing with, and then we'll dive right into the Medicare presentation. As I said before, my name is Lauren Marms, and I specialize in Medicare supplement plans and really all of the insurance products for the senior community. I am the owner of Medicare Solutions Team and My Burial Insurance Plan. I've been serving the senior community for over 12 years. I'm licensed in 46 states, contracted with over 20 Medicare supplement companies and 12 final expense life insurance companies. What we do is we help people understand how Medicare works, what your options are, and what steps you need to take before you turn 65 or retire and start Medicare. We've been helping people with Medicare since 2010, and I absolutely love it. I really enjoy teaching Medicare and working with this country's seniors. I eat, sleep, and breathe Medicare, so you don't have to. Now, I'll be quick with this, but I want you to know how I got into the Medicare arena. I think it's important that you understand this. I first started in the health insurance business before the ACA or Obamacare was the law of the land. I'd looked at Medicare, but I was told by several people that it was just too much work and having to recertify every year was a hassle. So I let it go for a little bit, but I constantly had clients that were aging into Medicare and asking me for help. I just couldn't see sending them off on their own to try and learn and understand Medicare. That just didn't make sense to me. I was their agent after all, and they trusted me to guide them through the health insurance landscape and explain all the options available to them. By not helping them when they were starting Medicare, I felt that I was abandoning them when they needed me the most. So I started reading the Medicare and You book. I read it cover to cover. I watched videos, trying to piece everything together, trying to put this Medicare information inside my head and make it make sense. Maybe some of you can relate to this. I'm trying to wrap my head around this Medicare information, and then I find out it can be different in each state and even different in each zip code. Well, after a couple of frustrating weeks, I knew I needed help. Keep in mind, I'm in the health insurance industry at this time, and I knew the terminology, but I was still struggling to understand it all. So I called my friend Jack, who had been in the insurance business and helping people with Medicare for over 10 years. I said, Jack, I've tried everything. I just don't get it. Would you please help me and teach me how this works? Well, he kind of laughed at me at first, and long story short, he agreed to help. And at the end of our 45-minute, hour-long conversation, I finally had all the pieces put together. He clarified everything, and it turns out I was the one making it way more complicated than it had to be. After that, I felt very confident about Medicare. And that day, he gave me the gift of understanding it. He laid it in very simple terms and gave me a roadmap that I could follow. I've been following that roadmap and teaching it to seniors ever since. He gave me that gift of understanding, and today I'm going to give that gift to you. Excuse me, I take a drink. If I pause and take a drink, I'm the only one talking, so it gets me a little bit. So if you're turning 65 or retiring and leaving your group employer plan to start Medicare, then you're absolutely in the right place to learn how Medicare works. Now, if you don't like my style, I get it. I understand some people don't, and you don't feel obligated to stay. If you prefer to discuss this one-on-one, I'd be happy to help you. Click on that green button, schedule your Medicare assessment, and set appointment. We'll call it, we'll answer your questions one-on-one, and you won't have to sit through this. Otherwise, stick with me. So if you like my style and you think that we can be a good fit to go through this content today, stay tuned. We're going to dive right in. Please get your pen and paper out now so you can take some notes and jot down any questions. We'll wait for just a minute for anybody that's got to grab one quick, a couple seconds, and let's jump into the webinar. Before I do that, one little housekeeping thing, I'm going to go up here. I know how technology works. Sometimes your Wi-Fi cuts out, you get a phone call in between, something happens. Here's my number up here, 844-528-8688. If anything happens, you can jot that down. It's on a lot of the slides throughout this. Excuse me. So feel free to jot that down and give me a call if you have technical difficulties or you got to jump out and you haven't had a chance to set an appointment. I'd be happy to help you. Now, in this training, we're going to cover how to sign up for Medicare, the parts of Medicare, what a Medicare Advantage plan is and how they work, what a Medicare Part D plan is and how it works, and what a Medicare supplement is and how it works. So we've got a lot of people on here today. Please put your questions in the chat box. I'll either answer them at the end, or if I think they're going to help everybody, I'll answer them in between as we go along. I will see them come through, and if you've got one I think it's going to help the whole group, I'll do it then. Otherwise, I'll do them all at the end, okay? So first off, before anything else, you need to start Medicare Part B. Nothing can be started before you've got this taken care of. No Medicare supplement, no Medicare Advantage plan, no Medicare Part D drug plan, nothing, okay? Now, you can put Part B on hold if you're going to remain on an employer group plan that has over 20 employees. So if you're working, you turn 65, and your employer's got 1,000 employees, and you're going to not retire till you're 68, you can put Part B on hold and you will not be penalized. That is the only way you can postpone Medicare without being penalized, is to be on a group insurance plan. So for signing up, if you are currently receiving your Social Security benefits, say you took them at 62, 63, you will automatically be enrolled in Medicare Part A and B. You'll be sent a Medicare ID card 3 months before your 65th birthday. If you're already on Social Security, or when you do start Social Security, your Part B premium will be automatically taken out of your Social Security check. Now, if you're turning 65 or starting Medicare and not receiving Social Security, you need to sign up for Medicare through the Social Security Department. They will then bill you quarterly for the Part B premium. Now, there's 3 ways you can sign up for Medicare. Online at Social Security's website, ssa.gov, Sierra Alpha.gov. Anything to do with the government is a .gov. This is the easiest and the best way to track progress, especially in today's environment. You can call Social Security and do it over the phone, 1-800-772-1213. What they're most likely going to do with that, if you call them, they're going to set up an appointment for later on down the road and then call you back or schedule a call in. Or you can visit your local Social Security office, maybe. A lot of them have different hours now after the pandemic and things like that. So I would give them a call if this is the option that you're going to do. I highly advise doing it online. Again, that's ssa.gov. You can sign up no earlier than 3 months before the first month that before the month of your 65th birthday. For instance, if you turn 65 on June 17th, you would sign up 90 days before June 1st. You can sign up 85 days, but you can't go any further out. You can't sign up at 100 days. Now, if you're turning 65, your Medicare will start the first of the month in which you turn 65. For instance, if your birthday is 7/10, your Medicare will start 7/1. There is an exception to this rule. If your birthday is on the first day of the month, your Medicare will start on the first day of the month prior. For example, if your birthday is July 1st, your Medicare is going to start June 1st. Now, if you're older than 65 and had Medicare Part B on hold while you still had group coverage, you're going to need your employer to fill out Form CMS L564. CMS L564. Go to your HR department. They should have this form. If they don't, give me a call and I'll email one over to you. This needs to be filled out by your employer, not you, and it will be turned into Social Security along with your application. If you do it online, they'll give you a fax number to fax it or a place to upload it or mail it in, whichever. Now, some of you people might not be done working, and if you're still working, you have a couple different options. If you're working and covered on your employer's insurance plan, choice 1, you can enroll in Medicare for the first day of your 65th birthday, or you can stay on your employer plan and delay your Part B until you wish to retire. Those are the 2 options. But there's some factors you need to consider when deciding whether to drop your group plan and go on Medicare or to postpone Medicare and stay with the group plan. Excuse me. Number one, you need to compare the benefits. What's the maximum out of pocket, the deductible on your Medicare versus the employer plan? Very seldom is this better on the group plan. Number two, what is the premium? How much is it going to cost for you to be on an employer plan versus Medicare and a supplement or Advantage plan? Number three, and this is the big one. Well, these two are probably bigger than the first two. Number three is if you take any high-cost medications, you want to look at both sides of the equation to see what's going to be in your best interest. What's your copays going to be on a prescription that you're taking on a Part D versus what you're paying right now? And number four, this is the one I see probably most often. If you have a spouse who is younger than you and is dependent on your coverage, then that's going to be a big factor in this decision. What is your spouse or significant other going to do if you go on to Medicare and drop that group plan? Are they going to go on their own employer plan? Are they going to have to go through the Affordable Care Act? This is the most common one. So now for all of you that are not working or that are retiring, don't worry, this is the last time I'll talk on this part on the subject today, because everyone's situation is different. If you're someone that needs to compare these options, please click the green button, set an appointment. We'll discuss the options and see which is a better fit. We'll go through all four of those stages. We'll compare pricings for the different plans versus what you've got now and do that in a one-on-one situation. All right, so this is Medicare 101, and other than how to sign up for Medicare, you need to know the term original Medicare and what that's referring to. Medicare is made up of 4 parts, but when someone says original Medicare, they're only talking 2 of those parts. Now, what you're going to see is I'm going to go through each part of Medicare quickly. I'm going to go through the individual parts, and then we're going to drill down and go over each part in detail so you understand what they are, okay? You have Medicare Part A, hospital insurance, Medicare Part B, medical insurance, Medicare Part C, which is a Medicare Advantage plan. This is not mandatory, and if you have a supplement or you just go with straight Medicare, you will not have this. Medicare Part D. This is a prescription drug coverage. This is necessary unless you have other coverage like the VA. Creditable coverage is what it's called. You are going to need a Part D somewhere, somehow, either in an Advantage plan or a standalone. These 2, Part A and Part B, are the only 2 that come from Medicare, and that is what they call original Medicare. So again, original Medicare is a term to describe Part A, hospitalization, Part B, medical or doctor's coverage. Now, Medicare does not pay 100% of the medical bills. There are some holes or gaps in its coverage, as you're going to see. Before I get in here, is any questions? Anything anybody needs to cover real quick? Don't hesitate to type it in the chat. Okay, I don't see anything popping up. All right, Part A. Part A is your hospital care, inpatient hospital care. That covers skilled nursing facilities, nursing home, hospice, home health care services. Part A has a deductible of $1,556 for 2022 for each 90-day benefit period. That's not an annual. Now, when I go through this, this is only original Medicare. This is with no other plans attached, okay? So Medicare pays for 80% of expenses under Part A. Now, this is not a per year deductible. This is a per period deductible. It resets every 3 months. If you go in for one stay in January, you will have to pay that $1,556. And if you go in again in, say, October of the same year, you'll pay it again. You're also going to pay 20% of the bill. Now, don't worry, we'll solve the problem of these big deductibles and copays in a minute. But it's important to understand that if all you had was Medicare by itself, this is how it would work. Now, the good news is, for most people, Part A has 0 premium. That means there's no cost to Part A as long as you or your spouse have worked 10 or more years. They call it 40 quarters. So Part A hospital coverage does not cost anything for most people as far as premium. Now, Part B is your doctor's coverage or medical coverage. This is going to cover all those types of bills from your doctors, outpatient surgeons, nurses, medical durable goods. It's also going to cover any medication taken in an outpatient setting, like your chemotherapy or MS infusions or rheumatoid arthritis infusions. Part B has an annual deductible. For 2022, that deductible is $233, and Medicare Part B also pays for 80% of expenses. Now, most people are going to pay $170.10 a month for Part B. That price will increase for individuals above 91,000 income filing single, and if you file jointly, it's 182,000. This increase is called IRMA, and it goes up incremental. And I'm not going to spend a whole lot of time on that here. That's something we can discuss in our meeting. So the 170.10 for Part B will be taken out of your Social Security check each month before you get it, if you're receiving Social Security payments. If you're not receiving Social Security payments yet, you will be billed quarterly. The way Part B works is, of any doctor bill, you're going to pay the first $233 for the year. Then after that, you're going to pay 20% of any medical bills that there is. There's no limit to how high the bills can get. Normally, insurance plans that you've been on in the past have what's called a maximum out-of-pocket limit. Original Medicare does not have an out-of-pocket maximum. And that's a scary part of this whole thing. If you have Medicare by itself and you've racked up a $100,000 medical bill, which in today's world, it just doesn't take very long, the 20% that you would owe out of your pocket is going to be $20,000. That's a big chunk of change. Most people just don't want to do that or can't do that. So you can see there's some major holes in Medicare's coverage, but there's a couple ways we can fix that. So let's go through that. So with your sheet of paper, on the left side of your paper, put a line right down the middle, please. On the left side of your paper, write down Medicare Supplement. On the right-hand side of your paper, write down Medicare Advantage. Now, these are the two types of paths of going on Medicare that help fix the problem of the holes or gaps in original Medicare's coverage. These two paths are completely different in the way they work. So we'll look at Medicare supplements versus Medicare Advantage plans. Now, there's no right or wrong answer, but there is going to be one option that fits your needs and your budget more than the other. So let's take a look at the differences. We're going to start on the left-hand side of your sheet with the path of original Medicare and a supplement or Medigap. We start with Part A and Part B, which we already covered the benefits of those and the costs. But now you're going to add a Medicare supplement plan through a private insurance company to fill some or most of the holes in Medicare's coverage. They also call them gaps. You get the term Medigap? So we want them to cover things like the Part A deductible and the 20% coinsurance for Part A and Part B that isn't covered. Now, your Medicare supplement will be your secondary insurance. And depending on what supplement or plan you select, it can pay for most or all of these copays and coinsurance that you would be responsible for if you had just had Medicare alone. Also know that Medicare supplement and Medigap are two different terms for the exact same thing. Now, the way you would get your prescription coverage on this side of the equation is you would add a separate Part D drug plan. So the path on the left-hand side, path 1, you have original Medicare, a Medicare supplement, and a separate Part D drug plan, which we'll get into in a little bit. Now, on the right side of your path, this is Medicare Advantage plan. So on the right-hand side of your sheet, write Medicare Advantage. Now, I'm sure you've seen the TV commercials every 5 minutes with the retired football player talking about free this and that from Medicare. They're talking about Medicare Advantage plans. Advantage plans work very different. This is where Medicare is contracting out Part A and Part B services to a private insurance company. They are paying a private insurance company to administer your Part A and Part B benefits. So if you go with path 2, you are in fact exchanging original Medicare for an all-in-one network type plan. That plan now will determine what the deductibles, copays, and coinsurance are going to be and what your out-of-pocket costs will be. They used to call Medicare Advantage plans replacement plans, but CMS, who runs Medicare, no longer wants that term used, so don't tell them I said that. If you go with a Medicare Advantage plan, the prescription coverage is going to most likely be included in that plan. They call them Medicare Advantage Part D, MAPD plans. Now, there's pros and cons to each of these two paths, and that's what we need to talk about. So this is what your sheet's going to kind of look like. On the left-hand side, you've got original Medicare, Part A and Part B, and you would add your supplement and your Part D. Or on the right-hand side, you would have Medicare Advantage plan, which combines the Part A and Part B from an insurance company. And most likely your Part D is going to be included in this. Okay, everybody got that? All right, let's start talking about path 1 with a Medicare supplement. Now, as far as coverage goes, a Medicare supplement is much more comprehensive. After Medicare pays its portion of the medical bill, your Medicare supplement pays its portion, leaving you with very little out-of-pocket costs if you end up seeing the doctor or going to the hospital. Now, the monthly premium cost is going to be the monthly premium of Part B, which you're going to pay that Part B premium whether you go with a supplement or an Advantage plan. That's kind of a till death do us part type deal with that Part B premium. So you would have $170.10 plus the monthly premium for Medicare supplement, $75 to $150. Again, it depends on your zip code and the plan you select. The cost of the Medicare Advantage or Medicare supplement plans, they vary greatly, and we'll discuss how they vary in just a little bit. So next is with path 1, there's no networks. You can see any doctor anywhere in the United States that accepts Medicare, period. It does not matter which plan you choose or what company it's with. You don't have to call me and say, hey, Lauren, I'll have to call my doctor and see if they accept Mutual of Omaha or Aetna or United Health. You don't have to. It does not matter what plan or what company. You can see any doctor anywhere in the United States that accepts Medicare. If the doctor accepts Medicare, then Medicare supplement will pay its portion of the bill. I stress again, The company your supplement is through does not matter. All that matters is that your doctor accepts Medicare. Your provider is going to bill Medicare. They will pay its part, and then they're going to pass that billing on to your Medicare supplement company, who will pay accordingly to what plan you have, F, G, N, what have you. Well, finally, how you get a prescription drug plan is you will get a standalone prescription drug plan in addition to the original Medicare and your Medicare supplement plan. The monthly premium for a Part D prescription plan, which for most people is between $7.30 and $30 a month. Now they do go higher, but these are averages. The Part D plan that's the right fit for you is going to vary on what prescriptions you're taking and what pharmacies you want to use. The other side of the equation, path 2, we're going to go over the Medicare Advantage plan now, okay? So if you go with a path 2 with a Medicare Advantage plan, you will have higher out-of-pocket costs when you go to the doctor or hospital. That's a simple fact. Each Medicare Advantage plan has different copays or coinsurance that you're going to pay for each doctor visit or each procedure. You will pay these costs until you reach the out-of-pocket maximum for the year. Depending on what zip code you live in, most plans' maximum out-of-pocket is going to be between $3,000 and $6,000 for the year. You would have to pay that before your coverage is 100%. And this out-of-pocket maximum does not apply to your prescriptions, no matter what plan. It is for the medical portion only. So with path 2, the coverage does leave more exposure for you to pay out-of-pocket expenses when you use it, but the premium is much cheaper than a Medicare supplement, sometimes even zero. So with a Medicare Advantage plan, you will need or want to be seeing doctors or hospitals that are in network with your plan. Some areas have very strong networks, whereas others can be limited to the doctors or hospitals that are contracted with a particular insurance company. So this can be a real problem for certain people in certain areas. It just depends on your situations. And I'll be able to look at that with you if path 2 is what you're interested in. Some downsides that you're going to need to understand is that with a Medicare Advantage plan, you will need referrals and prior authorizations. This right here, prior authorizations for surgeries or procedures, is by far the worst aspect of these types of plans. I've seen them cause many issues for people. It's not uncommon for procedures to be denied and have to be resubmitted or appealed. Couldn't get that out. Because it is prior authorization. Now, lastly, with an Advantage plan, the drug plan is usually included with the Medicare or medical, which means you can't do them separate. Sometimes that's a good thing, sometimes it's not. It can, you don't have a choice to look at other drug plans because it is what it is. There's some pros and cons here, and when deciding what's going to be best, I like to think of it like this. Path 1 with a Medicare supplement, you're paying a higher premium, but you also have coverage that is likely better than you've had in a very long time, if not ever. No referrals, no prior authorizations, and the freedom to go to any doctor anywhere in the United States that accepts Medicare. You also get this one shot for being new to Medicare to go into a Medicare supplement plan, no questions asked. Now, there are some states that have other enrollment periods, but that's a case-by-case basis and something we'll discuss one-on-one with your particular state. If you're the type of person who does not like surprises, you'll be traveling, or you want to be sure of what your medical costs will look like each month, and you want the freedom to see any doctor you choose, well, then the Medicare supplement plan is the path for you. You'll have little higher amount you pay per month for premiums, but you will have very little out-of-pocket costs that will come up if you have a health issue. Keep in mind that if you're thinking, hey, I'm healthy now, I'll go with an Advantage plan, and then when I have some issues, I'll get a supplement. That's not going to happen. Once you're out of your initial open enrollment, if you want a Medigap plan, you will be underwritten and can be turned down. That's kind of like putting insurance on your car after you hit the tree. Okay? Again, some states have some different rules, but this is more of the rule across the country. Now, path 2 with a Medicare Advantage plan. If you're the type of person that needs or wants lower monthly premiums and are okay with the fact that if something happens with your health, you're going to have copays or coinsurance that you're going to be responsible for, path 2 might be an option for you. It's incredibly important that we go over all the details of the Medicare Advantage plans that are available to your particular area. So if path 2 is the way you want to go, we will go with over all the specific details with you in your own personal call. You can choose a date and a time that works for you by clicking the green button. As far as Medicare Advantage plans go, since they are so different by region, that's all the information I'm going to do on them. So I'm not going to keep stretching them out. So get your call scheduled if you think an Advantage plan is the way you want to go. They're very different by zip codes, by county, what doctors are in network for which plans. So if that's the way you want to go, please set an appointment. We'll do it independently. All right. Since path 1 with a Medicare supplement is more straightforward, we're going to go into a little bit more detail about that now. Now, going back for a second, remember those holes we're trying to fill and protect you from. The big ones are that Part A deductible and the 20% coinsurance that has no ceiling or maximum out of pocket with Part A and B. We're going to plug those holes with a Medicare supplement plan. Now, there's 10 different Medicare supplement plans available, but by far, Plan G is the most popular, and second to that would be Plan N. Here's a quick look at them with the benefit package, Plan G, Plan N. Plan F you maybe have heard about, but if you are eligible for Medicare after January 1, 2020, Plan F is not available to you, so I'm not going to go into anything on that. Now, Plan G is a very good plan. It covers 100% of all the holes in Medicare except for one. The only thing it does not cover is the Part B deductible, which is set by Medicare, and for 2022, as we mentioned earlier, it's $233. Annual deductible, you pay it, and you're done for the year. If you have a Plan G Medicare supplement, the only out-of-pocket bill you'll get for medical now is the $233. I love Plan G. It really keeps your coverage as simple as possible, but it does have a bit higher premium and rate increase history than the next plan we're going to discuss. Now, the second most popular plan is the Plan N. Plan N is generally about $25, $30 or more less a month and is very similar to Plan G. However, with the Plan N, you will have a copay maximum of $20 when you go to the doctor's office. It doesn't matter if it's a primary or specialist, it's an office visit. You will also have a $50 copay at the emergency room. Unless you're admitted to the hospital, then that copay is waived. It has the same $233 deductible, just like the Plan G. And the last difference between the Plan G and Plan N is the Plan N does not cover what's called the Part B excess charges. Now, this is where things, people don't understand this part. Part B excess charges are a 15% charge that doctors who are not assigned, remember that word, assigned with Medicare can charge in addition to what Medicare allows. If you have a Plan N, that will not be covered, and you will have to pay that 15% excess charge. This tends to freak people out, but it's not a big risk. As of last reporting, 93 to 94% of doctors in the United States accept Medicare assignment. Remember, assigned. If they accept Medicare assignment, they cannot charge the Part B excess charges. There are also 8 states that do not allow excess charges. So here's what it would look like. Just a quick overview. Doctor charges you $100, $120. Now this doctor accepts assignment. Medicare approves $100. They never approve what the doctor bills. Medicare pays its 80%, $80. The supplement pays 20%. They can't charge anymore. Medicare does not accept assignment. Doctor bill, $120. Medicare approved is $100. They pay their 80%. Supplement pays your $20, but the doctor doesn't accept assignment. So he's going to charge the excess charge. He's one of those 6 to 7%. He can charge you $15. With a Plan G, this would be covered. With a Plan N, you would pay that out of pocket. Now, I've got over 2,000 clients across 46 states, and I've never seen it happen. But you should be aware of it. In fact, we can look up your doctor and see if they accept assignment on Medicare.gov at any time. The other fact on the Plan N you should know is the Plan N historically has the lowest rate increases, and with the lower monthly premium, Plan N could be a very attractive low-cost option. If you're considering a Medicare Advantage plan, the Plan N should be looked at. It has a lower cost without the restrictions that a Medicare Advantage plan has. If you have some serious medical issues and have a lot of doctor's appointments throughout the year, Plan G is probably going to be a better fit for you. So is Plan G or Plan N better? Well, I love them both, but everyone's different. And I'm giving you the facts so you can make your own informed decision. If you're like most people and go to the doctor a couple times a year, the Plan N could very well be the best fit. It's normally $25, $30 per month cheaper. And with that being the biggest difference of the $20 copays, that Plan N is a nice low cost option. You know, you break it down, $30 a month difference in premium, you would have to go to more than one doctor's appointment a month just to break even. So here's a quick comparison. All right, so here's Bob. This is an actual quote, by the way, for this zip code, a male, 65 years old. They don't have any Part B, or they don't have any household discounts, and both are non-smoking. Bob has a Plan N. The premium's $102.63. 80% of all medical are paid by Medicare, and the Medicare supplement pays the rest. Plan N pays all the coinsurance and the Part A deductible. Bob's going to pay that $233 Part B deductible and that small copay when he goes to the doctor. Now, he's got the $102.63 times 12 months. He's got a yearly of $1,231.56. You add in the Part B deductible. His total out of pocket for the year was zero doctor's appointments. Remember, you're still going to have that doctor's appointment. Would be $1,464.56. Bob's got a copay at the doctor and $50 at the ER. Dan over here has a Plan G. He's paying $143.61. Same thing. 80% of all medical expenses are paid by Medicare and the rest by the Medicare supplement. Plan G pays all the coinsurance, Part A deductible. Dan also pays that $233 deductible. His yearly premium, $1,723. You add in the Part B deductible for his out-of-pocket, he has a total of $1,956. So you can see the difference. Even with that deductible added in, you can go to a lot of $20 office visits before you break even from that $500 yearly difference. Okay. Now, there are other Medicare supplement plans, but these are the two that I recommend, as some of the others have less coverage and a higher monthly cost than a Plan G and N, and that just makes no sense. If you do have questions or want to check out some of the other plans, click the green button when it comes up, schedule an appointment, and I can discuss with you any of those. But for today, Plan G and Plan N is all we're going to go over, as most people select one of those two. So now let's move forward and go over when the best time to enroll in a Medicare supplement plan is. The best time is 6 months before you turn 65. And the reason for that is you are locking in the price for that 6 months in advance. So if there's a change between now and your 65th birthday, you would already have your price locked up and you would not have to pay the higher price. That's a nice advantage for you that are roughly 6 months ahead of your 65th birthday. You're at a perfect time to be signing up for your supplement plan, plus you have time to set things up and avoid mistakes and simply get it off your list. Now, some companies will not let us sign you up till 90 days before, so we'll have that discussion at the appropriate time. Medicare supplements are available through lots of different insurance companies. Plan G or N, like we've been talking about, there's over 35 different companies offering them. In every area, there's tons of companies offering them. There's no difference in the coverage or benefits between one company's Plan G or the next company. A Plan G is a Plan G. A Plan N is a Plan N. It is that simple. The prices are different, but the benefits are identical. They're federally mandated. Medicare supplements, when I say mandated, Medicare supplements are standardized. So the coverage would be the same with whatever company that is offering a Plan G, for example. So your Plan G with Aetna is going to be the same as it is with Mutual of Omaha, Blue Cross Blue Shield, United Health, or Bob's Bait and Tackle and Medicare supplement plans. The only difference is what's their customer service like and what their monthly premium and rate increase history is like. I know what you're thinking. What's the cost of a Medicare supplement? This is going to depend on your age, the zip code you live in, and possibly if you're living with someone. Some companies have a household discount. You just need to be living with someone. Some have a spousal discount where you and your spouse have to have the same Medicare supplement plan. Now, we've got over 100 people on this tonight, and it's impossible for me to list out every single person's run a quote form. It just can't happen. So hit the green button. It should be on your screen now. Schedule a Medicare assessment call, and we'll go over all the options and all the pricing. I can't stress this enough. They are different from not only state to state, but they're different in if you're urban, if you're in a city, if you're, the county you're in, zip code. So set it up and we'll get you taken care of. In general, to give you an idea, like I kind of showed earlier, you're going to be somewhere between $75 and $150 a month, depending on what plan you choose. We carry all the top-rated companies from across the country. And when you work with me or my team, we're going to look at all those options for your zip code and make them recommendation based off your needs, the most competitive price, and the highest rated companies. You don't have to worry about shopping around. We do that for you. That's what I'm for. All right. If you choose a Medicare supplement and find you have a problem for you, can you switch to an Advantage plan? Yes, Melanie, you can go to an Advantage plan any year between October 15th and December 7th and then it will start that January. There is never any underwriting when it comes to a Medicare Advantage plan. So anytime if you wanted to go from a supplement to that, you could. I never get that phone call, but yeah, I can do that for you. We would do that. I hope that answers your question. So with I lost my, okay, so we carry all the top companies. Now we'll do that. Now here's a few myths about the insurance industry that I want to let you know about, because I'd be thinking the same thing if it were me. The first myth is, Lauren, I must have to pay you for a fee as my broker to get help with all this stuff. All the services that you offer, plus this education, to sign up through you and with one of these insurance companies, I must have to pay you a fee for your time. Well, that'd be logical, and I wouldn't mind it, but that's a myth. Okay? The truth is, we do not charge you for our services, and you will not pay us one dime over the course of our relationship and working together. The service we offer is free. Now, that's going to take us to myth 2, because if you're like me, you're probably thinking, well, nobody works for free, so the insurance company must be charging me a higher price if I go through you as my broker. This is not true. The truth is, you are going to pay the exact same price whether you do all this that I've gone over on your own and sign up for a Medicare supplement directly, or you use me or a different agent. All insurance agents and brokers pay is included in the premium. It's already built in, whether you go through an agent or not. However, if you do go directly through the supplement company, they're not going to show you anybody else's rates, and they're not going to get you the lifetime billing support that you would get through us. If you've ever had to call customer service for a health insurance company, you'll know why this is very important. I'll do all the jumping through those hoops. You won't have to. I'm the person you call. First call. So that takes us to the next myth. Lauren, if you get paid directly by the insurance company, you must have a bias towards one company or the next, because that's who's going to pay you. Well, that's not true. Well, there's some agents out there who only represent one company, and that doesn't sit well with me, because of course, who are they going to recommend? They're not going to recommend what's in your best interest. They're going to recommend the company that pays them. I mean, that's just human nature. The difference between us and the truth is, we have access to over 20 Medicare supplement companies. Whichever company you choose is going to pay me. I don't have any bias towards one company or another. If we do not carry a company, it's for a very good reason, and you probably don't want to deal with them. Now, when we talk, I'll narrow things down for you and make a final recommendation. Like I said, it's going to be based off your zip code, your lifestyle, your budget, and the companies that are in your area. But I get paid regardless. And that's the beauty of it. It's a win-win. It's good for you. It's good for me. It's good for everyone involved. Everybody wins. So those are the myths of our industry. And the three truths: we don't charge fees. Your price is the same whether you go with me or you do it all on your own. There's no bias through me, because we have 20 different companies and we're going to get paid no matter who you go with. I wanted to go over this with you because I always like to know what someone's motivation is when they're trying to educate me about something or sell me something. I think it's very important to be upfront and honest with each other about how this works, so we're all on the same page and there's no secrets. Bear with me. And Annie, yeah, I think this will help everybody. Okay, so the question is, can I change from a G plan to an N plan before open enrollment? So I don't know exactly what you mean with that open enrollment, but if you're talking about the 6 months open enrollment for your Medicare supplement, yes, you can go from a G to an N. If you're outside of your open enrollment, okay, keep in mind that enrollment period in the fall between October 15th and December 7th, you see all the ads on TV. That has nothing to do with a Medicare supplement. That's only Advantage plans and Part D drug plans. For a supplement, anytime outside your open enrollment period, if you want to change from a G to an N, you'll have to go through underwriting, just like you were, even if you're in the same company, they'll do it. To be honest with you, I've had people want to go down, but I've never had them want to go up. I've never had anybody want to go from a plan N to a plan G. There's just never any reason to, really. They go from a plan G because of the higher premium and the higher rate increases. To lower their costs, they go to that. Annie, I hope that answers your question. If not, schedule an appointment and we'll talk about it more. All right, so we've talked about the original Medicare Part A and Part B and how they worked. We've talked about Medicare supplements, Plan G and Plan N, and how they work. Now, the one thing we need to talk about yet is the Part D prescription drug plan. But I just got to give you a quick warning. Prescription drug coverage is not the most exciting topic in the world. I'm going to spend a few minutes tops on this subject because I don't want to bore you to death, but there's just no way to make a prescription drug plan exciting. So I'm going to breeze through this. For those of you that are concerned about drug coverage and are maybe taking some high-cost medications, just know that in the one-on-one Medicare assessment, we'll be going through this in much more detail. If that's something you need to know, click on that green button, set the appointment, and we'll get it taken care of. So Part Ds are made up of 3 parts. All of the plans have these parts in one form or another: a premium, a deductible, copay, or coinsurance. Any plan has these 3 somewhere in it. Copays are set by what tier the prescription falls in, and you have these tiers right now in your insurance. You may not see it, but they're there. Your copays and what you pay for a prescription is set by this. Tier 1 is your lowest cost generic drugs. Tier 2 are the just generic drugs. Tier 3 is a preferred brand name drug. Tier 4 is a non-preferred brand name drugs. Tier 5 is your specialty drugs. And your copays go in order just like this. Now, for most plans, the annual deductible is normally only on Tier 3, 4, and 5. There is a plan out there, but it's very low cost. It does have a deductible for Tier 2, but it's less than $8 a month. So it works itself out. These plans are offered through private insurance companies. And here's how we're going to help you get the correct plan, okay? Our process is you email the prescriptions to us. We're going to use our Medicare cost calculator so you'll know the exact copays for your medication. It'll tell us what the plan will cover and what pharmacy is the lowest cost for you. Then we're going to help you select and enroll a plan that fits your situation. The biggest thing to understand about a Part D drug coverage is that the plans can change every year. We'll help you between October 15th and December 7th of each year to make sure that you have the best plan available to you. This is something that we offer to evaluate yearly with our clients. I've got clients that switch every other year. I've got clients that have been on the same plan for 8 years. Now, maybe you're not taking any medications and are thinking, do I even need a drug plan? And I do recommend you take out a Part D drug plan on your 65th birthday. Even if you're only taking one medication or no medications, there's a couple reasons. One is if you're obviously halfway through a year and you were put on a medication, you would have the coverage Second, and more important, is that if you don't take Part D when it's first available, you get a late enrollment penalty. I'm reading a question, so bear with me for 1 second. And now I'm going to answer that at the end of this, okay? I've got another question similar to that I'm going to answer at the end. All right, the penalty for not having a Part D plan is 1% of the national average premium. So they're going to take 1% of the average premium across the nation of Part Ds, and they're going to add that to your premium for every month that you should have had a Part D and didn't. Okay, that's permanent. There is no getting out of that. Once you get it, if you get a $10 a month penalty, you're going to pay $10 a month for as long as you have a Part D. So that is why I recommend you take it out immediately, as these plans most of the time are very affordable, and the monthly premium on average is less than 15 bucks. There are some that are more than this, some that are less than this. That's probably my average. So now we're nearing the end. So to recap, the details of Path 1, Original Medicare Part A will have no premium. Part B has a $170.10 premium per month that is paid to the government. You're going to add a Medicare supplement through a private insurance company like a Plan G, Plan N, for example. The cost is based on your zip code, and we're going to find that out for you, most likely between $75 and $150 a month. Then you're going to add that Part D prescription drug plan. That will be about $15 a month. Melanie, no, a company like GoodRx is not a Part D plan. I'm going to touch base on that for a second. That is not a qualified Part D plan. You would get a fine if you just used that and did not have a Part D plan. But if you got a Part D plan, say the lowest cost one on the market is between $7 and $8. If you had that plan and your prescription was less copay with GoodRx than it was under your Part D, you could use the GoodRx, okay? You only pay your copays if you order the prescription. If the prescription's not filled, you don't get charged the copay, okay? Does that make sense? Melanie, everybody else that had that question, somebody put a 1 in the chat if that makes sense for you, if I explain that correctly. All right, so we're going to add that Part D prescription drug plan, and I'm here to help you with it all. I view this as 3 phases in your journey, from where you are to where you need to go. Phase 1 is what we're doing today, Medicare education. Now, the second phase is where you're going to be at, this exact point. We just completed phase 1, which is a general education about Medicare and what options exist. Now, phase 2 is specific enrollment advice based on your situation. Everyone's situation is different. The first step is to schedule an appointment by clicking that green button. During this consultation, we will get all of the details hashed out, okay? This is absolutely free, and this is a gift for attending this seminar. I will walk you through specifically what options you have in your area as far as the pricing and what situation you are in. We will guide you through step by step. Like I said, there's hundreds of people on this presentation, and the calendar space does run out very quickly. We can only help so many people, and there should be about, I think, 40 time slots left when I first started this. So those are going to go pretty quickly. So if you'll go ahead, click that green button, it's going to take you to my calendar, and you will be able to schedule your consultations with us on a day and a time that fits your schedule. While you're doing that, let's go through phase 3. So most places may just help you enroll, and then you never hear from them again. Like those telemarketers or that junk mail that you got, once you call in, you're done. They don't want anything more to do with you. Some of those organizations may not even be around in a year or two. We are a family-owned operation. As soon as you're a client of ours, you are in that family. We want to treat you with family not only now, but 20 years from now. And this is where phase 3 comes in. And this is the lifetime support that we're going to give to you, okay? Free lifetime support for claims and billing service from our client service team. This is where anytime you have a question on a bill, you have a claim, or maybe the doctor office didn't process your claim properly, and maybe you have a bigger bill than you expected, anything like that, you call my office. We can help direct you to where you've got to be, what to do, and help solve the problem. It doesn't happen a lot, but there are problems once in a while that come up. And it's very nice to have someone in your corner to help. I want to be the first call you make, okay? The other item on lifetime support is the free annual review. My favorite part is anytime that you want to review on your prescription drug plan or Advantage plan, like I said, that happens every year, or on your Medicare supplement if you get a rate increase. We're here to help you. I have no loyalty to the insurance company. My loyalty is to my customer. If you get a rate increase you're unhappy with, we look and put you on another plan. It's that simple. That is lifetime support. So, this is the end of the presentation. I appreciate you being with us and staying to the end. I've got some time. We're going to go over the questions. I've got a couple of them here. Edna, is it Adina? So if underwriting, yes, you would have to go through underwriting. Depends on, I'd have to talk to you and look at your situation a little closer. Most retirement plans are not considered group plans. Underwriting is where you're going to have to answer health questions, and you can be turned down. They're going to look at your answers. They may call you and talk to you, and they may also, and they're going to look at your prescriptions. So that's what underwriting is. And, I put through people on underwriting every day. If you have anything big, heart attack, cancer, stroke, no, you're probably not going to make it. One other problem with the retirement plan is you have to know when they're going to let you out of it. Is it only between October through November? So you're going to have to talk to their HR department to find out what that is. I hope that answers your question. Any other questions while we're here? Type them into the chat. If everybody, I'm going to take that green button off for a minute. Any other questions coming in? Throw them at me. No, Don, that money back on your Social Security that they ask about, that is if you're on Medicaid. Some states do have a little bit, but if you look at those commercials, they have a small disclaimer that you have to be on Medicaid. That just means that the state pays your Part B premium. So no, I wouldn't buy into that. We can talk and go about that. Donna, yes, I do business in Florida. I am licensed in 46 states. Doris, you're welcome. I'm glad I could help. Hopefully we can help you down a little bit down the road with anything. Any questions that come up? I know I went over the hour. I try to keep it at an hour, but sometimes I go over a little bit. Jennifer, yeah, Part D is between October 15th and December 7th. You can change plans. No, there's never any underwriting for it. Well, well, thank you, everybody. I appreciate everything that you've said. Like I said, I look forward to working with you. If I'll put that offer back up while I'm doing this, in case somebody needs to do it. Well, thank you, Doris. I appreciate that. Yeah, the appointments are filling up pretty quick, and I appreciate it. Okay, Paula, it should be on your screen now. Give me a 1, Paula, if you can see that. Jim, you too. I think I did that while you were typing. If you know of anybody else, I do these twice a week. I do one in the evening and one during the daytime for people that have different schedules, so I can hopefully meet everybody's schedule. So if you know of anybody, give me a call. My number is 844-528-8688. That's about all I got. Did anybody need anything else from me? Paula, are you good? Paula, give me a 1 in the schedule if you're okay. If you can still see that, we're okay. Okay, Paul, I was just asking if you had the chance to fill that out. I didn't want to take it off while you were. Okay. All right. All right. Anybody need anything else from me? Okay. Here, I'm going to put the link to that in the chat so you guys can copy it and open it up a tab after I close this out, if you'll just bear with me for a minute. Is there a rating system for agent? Is there a rating system for agents? You can, if not a centralized one, you can look up. I can give you my website, and you can see what my Google ratings are that people have had. If you want, I welcome you to, go ahead and look that up if that's what you want. I don't understand the question, I guess. Anything else? Donna, I'm sorry, did I answer that? Oh, no. No, the companies we represent have ratings, like A-rated company and stuff like that. But I don't know of any specific rating for the agent themselves. You can Google me. Google Lauren Marms Medicare. You'll find me all over the place. And I can, like I said, I welcome you to look it up. I get it. You want to see who you're dealing with. I fully understand, and I welcome it. I hope that answers the question, Donna. That's the best I can do. Anybody else? Here, if I'm going to put, okay, it looks like we're all done. People are starting to leave. Well, we got a lot of those filled up, those offers. Anybody else still needing to fill out the offer while I'm doing this? All right. Well, I'm going to end it. Thank you. We'll talk to everybody soon. Thank you for trusting me with your Medicare needs. I hope you enjoyed the information. If you have anybody, friends, family that are in the same situation, turning 65 or want to retire, please, if they want to attend, they can give me a call. I'll send the link out over to them. Or if they want to talk to me directly, that's fine. 844-528-8688. That's my toll-free line. Oh, everybody, thank you again for attending. For those that set up an appointment, thank you very much. I appreciate your trust, and you all have a wonderful evening.